Hi, this is Dr. Karl Goldkamp. A few things I have to say. One is, we personally are involved both as a lifestyle, the ketogenic diet, but also through my 16 years of clinical practice of what is effective. What do people need to take sometimes, all the time, to support their ketogenic diet? You'll get bits and pieces of this ongoing week after week. It's important to be comprehensive. In one way it's simple, and one way it's a little bit complicated.
Okay, so this is Karl, and I'm going to be interviewing a brand new person to ketogenic diet named Brian. And we're going to start from scratch in terms of actually before he even chooses to start doing the diet, which is what I consider very important, getting awareness of what's necessary to do before you start doing it. So Brian, first thing, do you have any questions for this whole little journey you're going to go on? And what are some of your thoughts, concerns?
One of the first ones for me, just mostly because I haven't really followed any type of strict kind of diet. At the present moment, I don't really have a lot of time trying to eat out a lot, or sometimes I skip a bunch of meals. But, for me, being able to access the foods that I'm able to eat, if that's going to be a problem for me, is going to be kind of important. And my biggest concern is not being able to get to it, like having my busy schedule actually get in the way or hinder that.
Yeah, that's good. So convenience, talking about convenience. Well, this can be done pretty much in any scenario, unless you're locked in some closet and somebody's force feeding you food against your will. So let's say, I'm going to pretend you're slightly somebody else. And you're a person that goes, I can only eat at McDonald's. That's the way my lifestyle is right now. And it's just is what it is. What can I do? And I said, we can start there. And you can work within that menu. Clearly, it's not the best food, but we can find where you need to focus on that. And so it can be done in any context. In terms of you having to package up things to take to work, either very little, and as you get into it, probably none.
Okay, so as a layman's person, what would you probably tell me to focus on?
Well, one of the things is, and you're starting to get into sort of the homework of, I know I've sent you a few links of things in the Facebook group that I want you to look at, how to calculate your macros, how to track your macros, and then we'll get into tracking your biomarkers, which are ketone and glucose down the road. But I would say the very first thing, so let's pretend you are that guy who only eats at McDonald's, and you're not ashamed of it. That's just your life. So what would I do to help you in that context? I'd say, well, first we're going to drop the bun. Our first goal is going to be to drop carbs down to 20 grams or less per day. And so we're not going to look at proteins, eat the fats, they'll fall on your appetite's going to guide that. In essence, where we're starting is the classic Atkins diet, which clearly existed. It's actually the classic ketogenic diet for the most part that goes back to the 1920s. But we're just going to start there. If we can get you squared away by tracking your macros, you'll be working with MyFitnessPal. I mentioned that to you on the links that I sent you, and most of us use that. If we can get down that you now know you can track what you're eating, and then we can feel pretty assured that you now know what a carb is. You'll be able to recognize what 20 carbs are. So if we do that, that's clearly the most important thing, period. If you did nothing else, and we have some levels to go above and beyond this, if you did nothing else but that, and you knew you're absolutely sure day after day after day, that was going to be your golden rule for the diet. So it wasn't about limitations. It was just about limitations in the carb. That would be the one thing. And that in itself would make a dramatic difference in your life, metabolically, health-wise, sleep-wise, weight-wise. But we're going to go beyond that.
You mentioned something just now regarding sleep-wise. I'm very inconsistent with my sleep pattern. I notice that I wake up all the time in the middle of the night. And would you say that that's something attributed to diet?
Yeah, I would. I tend to put both by clinical practice. So 16 years I worked with people's diet, did blood work and everything else. Blood sugar is kind of the thing that drives so many other things. We can have 100 different articles, 100 different topics tied to this, but tying sleep to that, when one eats for their last meal is one thing, but what they eat for their last meal. So when we get into the whole ketogenic, that you're dropping your carbs and so on, and we'll get into maybe a little food timing. I don't want to put another limitation there, but then that's later. For instance, we eat at 6 o'clock and we're usually done by before 6:30. We've habituated ourselves for that because if we go to bed 9:30, 10, I want at least 3 hours of digestion, before I hit the bed. But it's not required. First step is to change what we're eating. But yeah, your sleep will change dramatically. And usually sleep patterns are about blood sugar more than anything else. It's less about the stress at work. It's less about, how late they work at night. That's clearly contributing factors. But the most overreaching and consistent is blood sugar.
That's definitely something to consider at a minimum if I'm having trouble sleeping. I mean, you're saying you're recommending at least 3 hours before going to bed, right?
Yeah, that's in the food timing. But before that, if you eat a high sugar, so a high carb diet, even 3 hours before, you're going to get not even a moderate improvement in your sleep. But if you change your diet, being low carb, and do that, put it in the back of your mind. But I wouldn't let that be a necessity at this point. You'll find a significant difference. Absolutely.
Oh, okay. That particular part just kind of strikes a chord with me, just because I've been so inconsistent with that for so long.
Yeah.
But let me see. Are there any common mistakes that you see newbies in the keto world make? In
the newbie world, and in the newbie keto world, a lot of people go chasing different aspects of what they think is a successful ketogenic diet, and it really depends on what they're chasing it for. If one doesn't have a serious illness or a real focus on why they're doing a ketogenic diet, meaning they don't have Alzheimer's or Parkinson's or neurological issues, it usually comes down to weight loss for most people that don't have a serious disease. So they're so driven by weight loss, they jump, and they do nothing consistently. And so I would say that's the biggest mistake. It's pretty much the biggest mistake in anything, because you can lose weight with other diets. This is just overarching in terms of health-wise. So that would be the first thing. Be consistent, and that's why you and I are going to be working together, so we get the 2 months of being consistent. And after that, you know what you're doing, and you can do whatever you want to do.
So let me ask you this, Karl. I know you said that you'd been a practicing doctor for 16 years. What was your specialty?
So I was a naturopathic doctor, acupuncture and Chinese herbal medicine, but primarily, your practice develops according to the patients you see, and then you find in time the patients that think you're most successful, your patients actually will dictate how your practice is going to go. So it ended up following a lot on diet and doing blood work and what they call genetic testings at various aspects. But the practice ended up focusing on people who were, in part, pretty seriously ill, so a lot of cancer patients, autism, and you had a degree of gynecological issues in the sense of menopause and PMS, but it ended up being nutrition-based. The first thing, once you had a full booked practice, you could start making demands, and my demands on patients were that they had to give me a 7-day diet diary, everything they had eaten for 7 days. That was a requirement. They also had to sign a form so I could then get their last 2 to 5 years of blood work from all the various doctors. So I had their history. And then we met and we talked. So my focus was, so I had their past blood work, and then I would order new blood work given their story. Why did they come to see me? And that was the beginning point. And so when I look at their diet, it was such an easy place to begin without being that knowledgeable about diet. What I mean is, if somebody's eating Twinkies 3 times a day, well, the first thing you should do is get out the worst part of their diet, and you would actually see improvement. You go well beyond that, of course. But that's was pretty much the gist of 90% of what I did. People got really involved when you got into genetic testing because that was fun for them. But it wasn't that necessary.
So Karl, I've been reading some articles, but they're drawing ties between hormones and diet, and how certain things that might be happening within your body because of an imbalance of hormones can be corrected just simply through diet.
I would say that's correct. Of course, that's a big generalization. You're talking about endocrinology, but some very specific issues. So I'm going to bring it back to basically a glucose, a carb-reliant diet, which is kind of the American way. And what we find is you have two easy examples to give. Is one is people rely on carbs. They tend to get overweight. And even if they're not overweight, they tend to get either what they used to call adult onset diabetes or type 2 diabetes. And as that starts to happen, you will have a lower testosterone. Your testosterone will go down. So often you now have all the sexual problems and ED issues. And that's for the men. For the women, you have a pretty well documented, meaning pretty well in the last 60 years. It's called PCOS, a polycystic ovarian syndrome. And what that is, it's usually non-menstruating or very irregularly menstruating women. Not only that, they tend to grow a mustache called hirsutism. And so you find these women that don't, they're not necessarily all obese, but their blood sugar will show that they either have become diabetic, they're dysglycemic, which means they have a blood sugar problem, or in that neighborhood. And so that clearly affects their hormones. And so what they find is when you go on a ketogenic diet or something very similar, that their hormones tend to come back and cycle. And therefore, people who have been wanting to get pregnant but couldn't because they're either PCOS or near so have become pregnant. So it's a big deal. So those are kind of two easy examples to give, and they can even get into thyroid and so on and so forth. But yeah, of course, things would affect hormones. And you can get into hunger hormones, a lot of other things. But so the answer to that would be yes, of course. The story is very big.
But yeah, I'm not really sure if I have too many other questions. I mean, I'm a pretty adventurous eater, so regardless of whether or not I'm going to be able to eat a lot of the same foods, it's kind of fine. I probably won't miss it. 9 times out of 10 when I'm here at the office, I notice that I find myself getting distracted all the time because I'm always so hungry. And 9 times out of 10, I usually don't even care what it is that I'm eating, just so long as I'm eating something.
Yeah, no, absolutely. I think that's going to change. One of the things, so we talked about for people who don't have a big serious issue, what are their experiences going to be? People talk about when they want to lose weight. All right, that's good. But the thing that's less emphasized for the average person is mental clarity. And so mental clarity is name your position. For everybody wants mental clarity, but whether you're a pilot or an attorney or anybody who just or a researcher who needs to be focused on what they need to do uninterrupted, this leads to that. You could sort of say it's the same aspects that people would use for Alzheimer's, in the sense that it improves brain function. Well, obviously in that case, you got to improve brain function. But for the average person, they will be able to say, I'm not that hungry. I'm not driven by that donut you're eating next to me in the next cubicle. But you could stay focused and go on your way. So that's a big deal. So I would say that's probably the number one thing that I have noticed is mental acuity, mental focus, sustained mental focus, and then secondarily, weight loss.
That's actually kind of a relief for me. I know that probably food is like the single most distracting thing regarding my workday, and being that I'm inside of an office for roughly 14 hours a day, it's usually not a good thing because that's totally sedentary. I mean, granted, I train Brazilian Jiu-Jitsu, so I usually get to the gym for at least a couple of hours, like 3-4 times a week. But, that said, there's a difference between working on your feet, doing that all day, and then being able to work out, or simply just hanging out in an office chair, eating all day and expecting that, what you do to be enough.
Yeah. You bring up peripherally, actually the third most common reason people get into the ketogenic diet, and that is about working out. And so probably the most dominant market versus weight loss. Second is about bodybuilders. And I'd say bodybuilders / endurance athletes, but not things like MMA or sprinters. So endurance athletes, we're talking about ultramarathoners, 100-mile runs. We're talking about, as an example, there was 2 long-distance rowing events. One was in 1914 from Monterey to Hawaii, and it was a husband and wife team that did this. The record was 60 days, and they decided to pack a ketogenic diet and had, in essence, been counseled to do this. And so they beat the record by 45 days. I'm sorry. They beat the record by 15 days. They got there in 45 days, way ahead of time. But the thing was, when they arrived, they were not decimated. They arrived stronger, not worn out, ready to go. So that's amazing. Then there was another.
That is amazing.
Yeah, there was another. I think it was a British group. It basically went from the Canary Islands to Antigua. So that's almost across the Atlantic. It is, if you want to sort of look at. It's more like going south-west. And that was it a 60-day? Anyways, they beat the record by, I think it was 60 days, and they beat it by at least 5 days. And they focused on, now this is 2 years later, this just happened in January this year, they focused on what they called an MCT diet. So an MCT is an oil that is ketogenic, and and they did little more than that, and they had some basic food, but they had a 4-man team, and they crushed it. So that's amazing. So those are the other things that people use this for. So, you have the person who needs the attention, you have the person who wants the weight loss, you have the endurance athlete, and then you have the weight resistance training person.
Somehow I actually fall under so many bits of all those categories, which is pretty wonderful. I'm really excited to see how this actually ends up benefiting for me. I mean, for me, one of the biggest things that I've always noticed, and this is even going back to even when I wrestled back in high school, and I even competed in jiu-jitsu back in high school as well, that when you're maintaining weight, when you're restricting calories, it's easy to look great, but looking great isn't really enough. I've seen so many guys smaller than me just have so much more endurance, so much more strength, just because they're walking around at their natural weight, eating how they feel they're supposed to, and that works great for them. However, for me, that's almost never been the case. I almost find myself, the moment I step off the scale, just pumping full of Gatorade, trying to eat as much as I can before any of my matches, just to get my strength back, because I feel like I have nothing. If these people are able to do endurance events, and actually not destroy themselves in the process, that's actually amazing. I've honestly never really heard of anybody in my kind of position actually have a similar type of effect through anything else.
Interesting. One of the things, I put jiu-jitsu along with MMA, mixed martial arts, and what they found in that is that, so the sprinter that needs or the MMA that needs to respond right there, is that what they did is they trained under a ketogenic diet, and then I think it was 3 days before, then they switched. They made sure it wasn't so much an amazing dietary change, but they just didn't worry about the fats and carbs. They started to carb up a little bit for those 3 days before. It was after they weighed in, and it wasn't. They didn't do it for the weight, but they really did it for a number of reasons: glycogen stores, fuel use of ketones, and they found that was the best mix. Whereas an endurance athlete, the endurance athlete, the 100-mile marathoner and these other people I've told you about, they didn't change. They were all about long, sustained effort again and again and again and again, and so there was only slight modification. So that's the interesting thing.
I'm definitely gonna have to talk to my instructors about that one, because that's a really cool concept, considering what it means. A lot of these guys who actually fight in MMA, they're doing their training camp for typically one match. These guys who train jiu-jitsu, they're doing the same type of training camp for similar lengths of time, except when they go for the day that they have to compete, their bracket might be an 8, 10, 12, 16-man bracket. So they actually have to go for multiple rounds if you're actually going to go ahead and finish. God forbid you actually make it to the end and you make it to the podium, and then you have the absolute division, which is the division of all the weight classes who've won medals. And that's another big bracket that a lot of people try to go and win a second time in the same day. It's not even like they get that downtime, So I can only imagine that for the jiu-jitsu person, the ketogenic diet on paper, from the benefits of it, sounds like it would be the way to go almost every time.
Nate, well, you'll be the one to get back to me on that, no doubt, as we go forward. So
that is for sure. Yeah, I'm definitely very excited for that.
That's cool. All right, any other questions? Any other sort of concerns you have sort of floating around?
Honestly, you really took a lot of my anxiety regarding this. Almost completely out. It really seems that there's going to be very little guesswork, if at all, for me, which I'm very excited about. I kind of thrive in that type of environment. I mean, and you even brought up some things that were underlying concerns that I didn't even think to bring up because I didn't think they were connected. Like, for example, the sleeping actually being affected by diet and things of that nature. Also, the mental focus is another thing too. I think being able to get more done, maybe, who knows, maybe I'll shrink my 14-hour, 12-hour workday even further. Who knows? Yeah.
Well, you strike me, and me knowing you strike me as a pretty intense person anyway, and you do rather intense, you're off, doing a lot of audio and other things together for other people, and you have to be off by yourself and focused. So that'll be interesting to see how you change in that regard of doing that. Okay, so if you have no more questions, let's go to sort of the bigger picture of what I call this pre-ketogenic diet awareness week. You started logging in just the foods you're eating now with no judgment on your MyFitnessPal, correct?
Yes, I have.
Okay.
No judgment is a little bit of a stretch for sure, but yeah, I've definitely been putting it in.
Okay, yeah, absolutely. If you got 10 beers or all this pizza, or I could care, or soda, it's like, It's fun to put into before because you can look back a couple months from now and you'll say, this is a piece. It's like a picture of what you were, providing this does represent you, whatever you're doing now. And we'll get to see how much was good and how much was, maybe not the best things you should have been eating.
Agreed.
Okay, so you got a scale, or you're about to buy a scale that allows you to do lean body mass. Is that correct?
Yes.
Okay.
Yes.
And down the road, we're going to, we call it the ketogenic diet not for nothing because it's about ketones. So we're going to figure out how to measure those. But actually, I think is even more important is measuring glucose. So we're going to do it just like a diabetic. We're all going to do the same old diabetic exercise, which is finger prick and, putting the strip in and getting a reading from the finger prick. And have you or are you planning to buy a meter? I've suggested a few meters to you.
Yeah, I am. I'm going to get the keto. I'm going to get the blood sugar meter first.
Okay.
And I'm going to get the UMI scale.
Okay.
Then later on, I'm going to get the ketometer. I know that you mentioned that I would be able to get strips in place of the ketometer for now.
Mm-hmm.
So I'm probably going to go ahead and do those instead, just for the beginning.
Yep.
And then hopefully sooner than later, I'll get the ketometer. I just want to make sure that I don't get it too late, so we can get the best data possible.
Good. Yeah, that's fine. So the strips, the urine strips, is what you're talking about, right?
Yes.
Good. They're really cheap, and the reason that if everybody could stay on urine strips, which they can't, because really the effectiveness of measuring ketones in urine is only for the first 30 days, and sometimes it's even less. And so the reason we encourage people to use it initially, they've never been in a ketogenic diet, is they go, oh my gosh, look at I can see ketones. You get to see the strip change. So it's like an attaboy. There you go, or an attagirl.
Yeah.
So and then you have to switch over to something a little more academic, that you can actually get a measure, and we'll do that. That's fine. So you got that covered. Okay. The sugar's great because we'll get to have, what are your sugars now? Neither good nor bad. You're obviously not diabetic, but we're going to say the whole world, by the way, when people talk about ketogenic diet, they express that there's a, absolutely defined, this is the way you do it. These are the numbers that are good for everybody. And that's never the case. There's so much personal variation. The idea of high fat, low carbs, moderate protein is a prescription, and everybody can do it their own way. But all of us are going to have different blood sugar, and all of us are going to have an easier time or a harder time to create those ketones. But in the change, or the adaptation, they call it fat adapted or keto adapted, that initially is going to be the first big step, is going to be a couple weeks. And then after that, even 6 months later, a year later, it's going to be changing for you. So it's never set in stone. And so that's why we do these meters, and we do it intermittent. So initially you're going to get trained to do all this, and somebody like you will get, partially obsessed with all this data and spreadsheets, which is fine. And then you'll learn to not do it for a while and just do life. And then you'll come back intermittently to sort of see where you are. And that's basically how this is. But initially we do have to sort of get teched up, geeked up to understand some of these things.
Yeah.
And so that's right up your alley. But learning not to do it when you don't have to do it is a good thing too.
Let's see. So, do you have any other words for me? I mean, for the most part, I feel like I'm pretty good prelim wise. I just got to get the scale ordered for now, and I'm pretty much good to go.
I think so. These are just the basic things, because the reason I say, you have to get the food scale too, so you could be able to weigh things. And all these things are cheap, and all these things inevitably are pretty necessary in part for your kitchen. So when we start talking about protein or carbs or whatever, the fat's the one we really don't have to weigh too much, but we are going to have to measure carbs, or have to get an eyeball and be able to recognize on a regular basis after a while, what does 20 carb looks like. You probably have no idea, and that's fine. What does, after we calculate your proteins in a ballpark amount, what does that look like? But we're just going to hang out. And we're not going to start this for a week, but so we're just going to, the idea, so you now have an awareness before we get started. I'm going to let you sit with that. You got your assignments. Keep logging away. If your glucose meter shows up, start taking your glucose and see what that is. It's fun to see it. You can do it first thing in the morning. You can do it in the middle of the day, after you eat, whenever you want to do it. But that's going to be another reference as we move on is that going to stay the same? Are you perfectly healthy right now? Or is it a little bit high and we're going to shave off 20 points? Who knows? But having that reference now would be a good thing to have.
Absolutely. Well, thank you so much for taking the time to talk to me, Karl. I really do sincerely appreciate it.
I'm good with that. I'm looking forward to it. It's going to be a fun trip.
Thanks for listening. For anybody who has any questions, feel free to contact me on our Facebook group, Keto Naturopath, same name as our podcast. I'm open to any questions, and we plod through the good and the bad, the difficult and the easy, week after week.